Mere months after the new international health regulations took effect, the World Health Organization has issued its first emergency declaration under that implementation for the Mpox outbreak in Africa, which seems a little bit premature as the risk gets inflated to ramp up fear.
Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern. I have accepted that advice. The detection and rapid spread of a new clade of Mpox in eastern DRC, its detection in neighboring countries that had not previously reported Mpox, and the potential for further spread within Africa and beyond is very worrying. In addition to other outbreaks of other clades of Mpox in other parts of Africa, it's clear that a coordinated international response is essential to stop these outbreaks and save lives.
Mpox, formerly known as monkeypox, has just been declared a global health emergency for the second time in 2 years as it continues to spread across the African continent. An alleged new strain of the virus with increasing cases in the Democratic Republic of the Congo prompted the African Center for Disease Control and Prevention, the African CDC, to declare its first ever public health emergency on August 13th. The Director General of the Africa CDC, Jean Kaseya, who supports global vaccine efforts, also notes that this declaration boosts coordination, speeds up research and development, likely as it pertains to big pharma profits, and improves cross-border responses. This is thanks in part to the amendments to international health regulations that took place earlier this year, coordinated, of course, through backdoor deals and informal discussions. The emergency declaration under the IHR means that countries in the region must begin to share information with the Africa CDC and better tap financial aid, according to Kaseya. After the African CDC's declaration, the World Health Organization followed suit and declared this situation a public health emergency of international concern, something that is the cornerstone of the IHR, those international health regulations.
Last week, I announced that I was convening an emergency committee under the international health regulations to evaluate the upsurge of Mpox in the Democratic Republic of the Congo and other countries in Africa.
But what is Mpox and how serious is it in the current capacity compared to previous outbreaks? Well, according to the United States CDC, this viral infection occurs primarily in gay, bisexual, and other men who have sex with men, called MSM. The virus causes pox-like lesions, a rash with raised bumps or blisters on the skin that fill with fluid or pus that eventually crusts and heals over. Originally discovered in monkeys in 1958, it was referred to as monkeypox. But of course, in our woke society today, those who claim to follow the science took priority in renaming it simply to Mpox because naturally it was racist and stigmatizing otherwise. Now, according to Our World in Data, there have been a total of 8 deaths in the Democratic Republic of the Congo since February this year. I'm not downplaying death because any loss of life is tragic and absolutely deserves sympathy. But according to the rolling 7-day average, this represents less than 0.003% relative to the total population of that country. Cases at their peak last month still only represent roughly 1.4% of the total population in the region. During the first global outbreak in 2022, Africa CDC received its first batches of an Mpox vaccine in November that same year. At the time, Canada was announcing $16.5 million for research to address the current global outbreak of Mpox and strengthen the ability to prevent future outbreaks. I guess that didn't work out very well. It looks like at least $3 million of that went to a partnership between the pharma-funded University of Toronto and the Nigerian Institute of Medical Research, which focused on 3 main topics: Mpox transmission, treatment, and vaccines.
When the panel said, listen, give it to 6-month-old babies with zero assurances this possibly would be safe. I said, where were you the day when the WHO came out and said, do not use remdesivir in the hospital? I'm Dr. Peter McCullough. Join me for an evening together. Tickets are on sale now.
Here in Canada, the largest public health unit, the Toronto Public Health Unit, has warned the public and urged vaccination following an uptick in cases after, you guessed it, Pride festivities. Interestingly, Bill Gates' global vaccine alliance known as Gavi has been ramping up vaccine efforts in these countries and this region specifically for the last several years, but has become increasingly emboldened in their efforts since the success of their pharma profits from COVID-19. They've utilized geospatial mapping to reach every child with essential vaccines, especially the zero-dose children. They've set up mass vaccination centers called vaccine domes to continue mass vaccinating the population in the Congo with COVID-19 vaccines. In conjunction with these potentially immune-triggering efforts, Gavi now claims that this outbreak has spread rapidly, primarily impacting children in terms of both morbidity and mortality and resulting in high case fatality ratio. Where have we heard that language before? And now the race to bring vaccines to market is on. As Bloomberg reports, at least one pharmaceutical company called Bavarian Nordic is prepared for the global rollout. Gavi's getting its hand in the pharma cookie jar to secure a partnership with them and secure that global stockpile of vaccines. The government of Canada issued a statement today detailing that since 2000, they have provided Gavi with more than $1.6 billion in core funding. So rest assured that the equitable access is coming on the backs of taxpayers in Western countries who are accessing food banks at record numbers and struggling to stay financially afloat amid inflation, excessive taxation, and a rapidly lowering quality of living. So how will the local, provincial, and federal governments act? Will this be utilized to usher in pandemic lockdowns and restrictions months ahead of a very important U.S. presidential election, justifying things like mail-in ballots and other voting restrictions? Will governments and the general public once again succumb to the hysteria that is Tedros's nonsensical parameters for a public health emergency of international concern? Or will cooler heads and actual evidence-based decision-making without pharma interference prevail? For Rebel News, I'm Tamara Ugolini. Follow this kind of coverage and support our work at exposethewho.com. At that website, you can stay up to date on our accountability journalism as we attempt to disentangle globalist enterprises that capitalize off of your fear. Sign up so that you never miss an update and chip in if you're able to at exposethewho.com.